let's talk about behavioral health. Renee, what's the topic today?
Today, we're talking about collaboration, which has become one of our favorite topics in our business. I'm
Oh,
really excited about this topic because we're talking about really what is it, how does it work, what are some best practices maybe we've seen, and some places where we've seen some real disasters. But before we dive into that, Jason, what's going on the farm here in February?
well, Renee, this is the decluttering time of year. I think
Oh,
every year at this time I talk to you about like it's time to get rid of some stuff.
yes,
And, it's always thinking about spring breaks coming up. And so I always list a whole bunch of stuff on eBay. And so this year I walked
yes.
around the house and I found an old milk bottle of bottle caps, the cork lined bottle caps from the 50s. It was probably my grandfather's bottle cap collection. I don't even know how it ended up on a shelf in my basement. But do you know
Nice.
these are going for 12 bucks a piece on eBay right now?
No, you could be rich.
So I'm just selling bottle caps one at a time. They're very unique, they're very rare.
More than a bushel of corn.
Um, yeah, well, yeah, how about that? Yeah, I owe way more money in bottle caps than I do in frickin' corn. Thanks, Renee, for that. Yeah, so this is a far better crop of bottle caps
There you
than the
go.
corn ever will be. So,
Well, I don't know if you've heard, if you've ever asked Brent about this, if you've heard about his 7 Up can collection from
yes,
1976 that
yes,
builds the Uncle Sam on the backside of the 50
yes,
states. It's still in my closet.
yeah,
So when we decide we want to really get eBay, I know the guy I'm coming to because
yeah.
I don't need a 1976 collection of 7
So
Up cans.
although my wife has said, decluttering doesn't count for 42 bottle caps. Like you got to do
Oh,
more than that. But, you
I
know,
kind of see your point.
you got
But
to start somewhere, right?
oh my gosh, I love it. Well, today, folks, we're going to be talking about collaboration and care collaboration specifically. We're thinking about whether it's you as a patient. I think about my dad who's got some chronic issues. There needs to be care collaboration of working together, providers knowing what other providers are doing, so that you kind of have one care plan and we're working toward a goal. And when it gets to behavioral health and even in other challenges in healthcare, it's not always like that. It's kind of more disjointed, not really going with that flow. And so without that collaboration, you could get mixed information on what you should do next, mixed diagnoses, mixed recommendations for meds, just mixed ideas, and it just confuses people. And so we're going to talk today about collaboration. And this is really part of that on the ground series where Jason and Brent went around 3,500 miles around the state
Yep.
of Iowa, lots and lots of meetings. And so just kind of giving you like the ground's eye view of what's going on in Iowa in this space of collaboration. So kick us off, Jason. Talk to us about collaboration. Why are we talking about this today?
Well, I mean, I think it's so much of this comes down to how are we communicating across the healthcare system? And
Yep.
we're one of the only ones out there talking about the healthcare system needs to connect everyone together. And I can tell you that, my mom had some significant medical issues over the last year, and now my mother-in-law has been in some of the hospitals that we were going and working with to put together behavioral health projects. And one of the things that I learned on the medical side of collaboration is even when all the physicians have access and all the specialists have access to the same medical record, there still isn't good communication. Nurses and specialists still aren't on the same page with PT and all the other things that have to happen for that patient when they're on site at the hospital. And then I think about mental health and behavioral health and substance use disorders. And when you add in other community providers who don't even have access to that EMR, who are completely disconnected from the healthcare system, is there no wonder why people don't get continuity of care and connections to the health issues that are occurring physically and disconnected from their emotional well-being? It just makes perfect sense because we don't do it well with healthcare when everyone has the tools, but yet we expect people who don't have any of the tools to do even better with more complicated issues. That's my soapbox, Renee.
This whole speech of yours just reminded me of when you told me about your favorite character in Roadhouse. I
That's
brought his
exactly right.
own, he brought his own pile of all his medical records because it was easier. You just
Yep.
hand it to him and be like, here, this is what we're dealing with. And even though we have all this technology and all these ways to connect and electronic records, I still think it might be easier if you just carried it with you and said, here, because
Yep.
you're right. They miss some really big things sometimes, even with the best of intentions. And in behavioral health, when a person comes in and they're not feeling well, not thinking clearly, and if you're not really paying attention, or maybe even having a second person in the room to catch what's being said, it just gets so confusing so quickly. And so this is a really good, really important conversation that we're having today about why this is so important. So when you're thinking about that in behavioral health, Jason, who, from your perspective on the ground, should be in the room when we collaborate? Like, who did you bring together that you're like, these are different, and maybe some out of the box even folks that are like, they should be in this room for these conversations?
Yeah, I mean, in the work that we did where we really dug in to systems, we would go to regional areas where they were pulling things together. And so I think of some of those systems were in more urban areas where they worked with and had systems to communicate across silos. So I think about law enforcement, I think about probation, I think about primary care, emergency departments, hospitals, behavioral health, substance use, system navigators, care coordinators, case managers, all of those folks, if we think about complicated individuals in our communities, there are individuals who will cross all of those systems in a given week. And it is entirely possible that someone will come into contact with all that long list I just named off, and no one will know in any of those other silos what happened. And all of these folks are duplicating effort all along the way, which guess what? Is costing our communities money.
Right. Right. And then think about people who have tried to make efforts to collaborate, and then there's still failures in those efforts.
Mhm.
So maybe there are groups where they try to collaborate, and we've worked with some groups. You've brought some groups together, but then you also have inserted yourselves where people were already meeting as groups.
Yep.
And even in those collaborations don't always work. So what are you seeing in that space as why collaboration fails?
Well, I mean, we have to have resources to do some of these things. And so good
Hmm.
intentions can only go so far.
Yeah.
And we've been stuck in some spots where people are, we've had some legislators strong arm us into bringing people together. And like, I can only do so much. Um, like I can talk, but like I can tell you what we should do, but without some incentives or some funding, it's going to be tough to see that through. And we've worked with other partners that actually have funding, and they still have trouble getting small initiatives over the finish line of keeping people engaged, of breaking down those silos and getting communication. I mean, we know the barriers, right? Turnover is huge. We lose relationships. We get disconnected. We get overwhelmed with other things happening in our organizations, and then we skip a meeting. That was really important to keep us connected with what some of those initiatives look like. And so all of those things contribute to why collaborations fail or collaborations fall away, even with the best intentions.
Yeah, I have an interesting segue here, but I have tech issues in my office, and there's an
Oh,
entire department in the state that does technology. In my state, my department is tiny, and we don't have any tech people, but they insist upon talking to me on a regular basis. And every time they're like, "Well, we need a champion in your office, to help us push these projects over the finish line." And usually it's projects we don't want, we
mhm,
don't really care about, and then we don't have people who even necessarily understand the language of what they're trying to get us to say or do, but they're like, but we can't tell you what to do, although they clearly are.
yeah,
And then you have to be the one to accept. And so sometimes you just get into this thing where you're like, there's no champions. And we've talked about this on a previous podcast that sometimes there's just a lack of leadership and a
mhm,
lack of people to own some things. And sometimes it's exactly this where they're trying to make me be a technology champion when I'm a therapist. That doesn't make any sense. And so sometimes that's exactly what we've done, right? We're like, we need to do mobile crisis, blah, blah, blah. And you're in a place where people don't have that language or no have the knowledge or the understanding, or you're trying to put the wrong person as the point person. I mean, it's a lot of things. And so when you're talking about collaboration, it's not just about getting people in a room. There's just so many
yeah,
parts of that. For it to be successful, you have to bring people together, and it has to make some sense. The right people in the right seats on the bus, real
mhm,
decision makers. We do this, you do this a lot. I heard about one of yours across Iowa, and I won't name any names, but when I talked to Brent about it, he's like, oh, the right people from that group aren't even there. He's
right.
like, no, that they have people showing up to say they had investment from their agency, but the actual people you needed in that room to make decisions and to make change never showed. And
Mhm,
that happens a lot too. You get the lady that had the 2 hours off that day. So you have to go to the meeting. I mean, how many times?
Mhm.
And we've seen this one a number of times. And you're
Yeah.
like, why is that person here from a place you used to work that you know, and they have nothing to do with what you were talking about? You're like,
Yep.
they're a nice person, but that's not at all their role. So why are they here? Right. And so there's that too, where it's just like the agency wants to look like they're collaborating, but they're not really sending a person that can make a difference. And so it doesn't really matter because the information they're bringing back isn't going to be impacted anyway. I mean, how many stories do you have about that just off the top of your head?
Well, yeah, and I mean, I think that's the difference between real collaboration and putting on the guys that we're collaborating, right?
Right.
Like, are we willing to dig in and do the work, or are we just going to take up a warm seat? Are we just keeping the seat warm and making it look good as window dressing? Or are we really digging in and trying to create a better experience for the patient? And we always go back to when we do these talks with people, this should be about patient experience as they navigate the continuum of care. And everyone in the room is part of that continuum, right? We love putting that triangle up on the board and saying, look at where you're at, put an X where you are in the continuum of care, and look how folks, go through your organization as they move up to more intensive services and move back down to less intensive services. And as people cycle through that, which they will, just like folks who have medical conditions may have cancer, be treated for cancer, and then have a reoccurrence of cancer 6 weeks, 6 months, or 6 years later, people move through the needs of the continuum of care of what they need, whether it's a medical issue or behavioral health issue. So why aren't we working on creating a better patient experience?
Yeah. Yeah. And in healthcare, I mean, it can just get so hard because I remember for my mom, we had a specialist that was in charge, but they tried to put together a care team. The issue was my dad was always angry because it didn't have the right credentialed people, in his opinion, to be worth the effort. And I
Mhm.
felt differently about that because that was one place I really felt like they tried. We had a real
Mhm.
social worker, we had real, clinical persons there, we had real support, and had my dad bought in, which is also a challenge in collaboration in healthcare. The patient has to be the one to buy in, or their significant other in that case. We would have been. But now my dad's in a situation where he has chronic health and doesn't have one of these teams. Vastly different because now he's mad because everybody's telling him different things and going different directions because he doesn't have a care team. So I appreciate what they were trying to do for my mom because they really were trying to do exactly what we're saying here. But again, if you don't have the buy-in from everybody, even if you had the best people in the room, but what would happen is they'd have this team meeting and everybody would beg off and maybe the one social worker would show. So you officially had a team of five, but maybe one would show. This is what my dad would get so angry about because it really then wasn't a
Yeah.
team.
And let's be honest with ourselves. Behavioral health care is really bad at team-based care.
Yeah.
We're really bad at including the primary care physician, a nurse at the local clinic, a pharmacist, dietary, and we don't use the continuum of care, and we don't engage partners across the healthcare continuum. Behavioral health care continues to work within a silo, and
Yeah.
it shows because
Yeah.
we don't know how to do team-based care in behavioral health care.
No, and where it really shows too is some many behavioral health issues have a physical component to them,
Yep.
whether it's causal or effect, either way. And so when we don't think about that, if we're not taking care of our dietary needs or our physical health, or maybe we have some cognitive issues, you may be in the behavioral health system trying to think that I'm having memory issues, I'm having cognitive issues. I have a family member exactly in this space having cognitive issues, but that it's compressed discs in a spine that's cramping the spinal fluid to their brain, which is causing the cognitive stuff. But they're thinking it's psychiatric because they're the opposite, thinking it's over there, but it's actually a really big physical issue that's causing this challenge. And so if you're not having that conversation many, many times because it's all one body, you're missing out. And sometimes we're trying to treat it as I'm just anxious and I need to talk to a therapist, when in reality, something could be wrong with your hormones, your cortisol, and just other things. I mean, there could be a lot of things. So in behavioral health, this could be a place we could really make advances if we talk together more.
And I think this is a great transition to what are we seeing then because healthcare isn't talking behavioral healthcare? And it used to make me angry, and now I'm kind of like, well, maybe this is the way the system should go. Is we're now seeing hospitals spinning up their own behavioral health clinics. And sometimes they're not even telling the local community that they're doing it because they just gave
Right.
up on trying to work with the partners. We were in one small community and there were three providers. One was identified as a substance use provider, but was co-occurring. One was a mental health provider. And then there was another provider that did safety net services. And then we went and met with a hospital and they're like, yeah, we don't work with any of them. We don't even know who they are. But we're going to go ahead and redo that wing of the building, and we're just going to hire their staff to do therapy ourselves because it's a need for our patients here. And if we can control the whole continuum of care, then that's better for us. And that used to make me angry because I'm like, well, that kind of undermines the local community. Like there's already resources. But then part of me is like, well, it wasn't working. So why not give them a shot at it? Right.
Right. Right. Yeah. And one of the things when the governor just did a condition of the state speech was talking about cancer, and in our state we were having really high cancer rates, and they're not sure why. So they put a lot of money into research and whatever. But she's trying to talk about this hub and spoke model, and in that, whether people like the governor or not doesn't matter. The concept, what she was saying is, wouldn't it be cool if you could go to one place, and this is for cancer, but think about it for behavioral health, where you could get the help you need, where you could get that screening done, and then maybe talk to your dietitian if you needed dietary changes, or talk to your pharmacist if you need a medication and whatever, and put it all in one place. And you and I have talked about this, about how we build buildings sometimes where they've excluded those. So in the places in small communities where they've brought the primary care into the behavioral health clinic or vice versa, sometimes you're seeing better results because a person comes to one building. It also can reduce stigma. If you're going to that place for healthcare, nobody has to know it's behavioral health versus healthcare because it's in the same building. So to your point, whether it's cancer care or this kind of care, if you're in one place and co-located is a place, because not everybody has just unlimited resources to go from place to place to place to place. Yeah. It costs money, vehicles or transportation or bus routes or whatever it is. It's a lot of hassle. In rural, it's even worse because it's even further apart. And so, co-location of some of this, and that's where telehealth can come in. And we never talked about this, but do you remember that really crazy doctor dude that I chatted with in Louisiana that had the virtual headset thing on?
Yes.
Okay. Well, we never talked about that in the Louisiana Louisiana conversation, but I want to bring it up now.
Yeah.
Very wild idea, but what he wanted to do was collaboration, and he wanted to have the voices of the other care team on his head so that he could hear and they could collaborate in real time with the person. So those people could be anywhere, but he could have the expertise. And he also had this weird little glasses piece that came around front so he could see documents. I don't know, guys. It was the wildest conversation I'd ever been a part of. And Jason left me. He just left me there. It was 45 minutes.
I watched from across the room this virtual reality headset thing going on, and like, I don't want to be part of that.
He just left me, people. He left me. But anyway, nonetheless, I learned a lot from this gentleman. So he has this headset in this thing. And so, but what he was really working on was because we had talked about collaboration. So he made a beeline to me afterwards going, oh my gosh, you get it. You understand the importance of collaboration. So he had this virtual reality idea. Will it take off? I don't know. Will I ever wear that thing on my head? Probably not. But I appreciated what he was saying, because he's like, well, because you could have the people there. And then she was really focused on, like, if you were that in-home care worker that went to somebody's home, they could have those doctors' voices there and they could all collaborate in real time, but they didn't have to physically be in the same location. It was a brilliant concept. Now, where we are today with AI and all of this in the future, there could absolutely be ways to bring this together if people do it right and really try to put the patient first. I think we could really get there with some innovation.
And there's a big push for co-location with the rural transformation funds happening right now, the one-time funds infused into the system. But let's remember, co-location doesn't mean better care, and it doesn't mean people will actually communicate. We've seen multiple times where we try to co-locate everyone together and no one will cross the hallway to talk to you.
Yeah.
Right? Like, it doesn't matter if you're crossing the street, crossing the city, crossing the county, or crossing the region, or crossing the district. The hallway can be just as big a barrier as 72 miles.
True. And so
we have to remember that doesn't solve our problem. This is a culture issue, and we've got to figure out, how do we link together better?
Well, that ties right into the next segment then, Jason. So how do we fix it? I mean, if we can't cohabitate people and put them together and make them work together, and that's not going to fix it, and some of this virtual reality, weird things on our heads aren't going to fix it. I mean, what do we need to do? And yet you just started the conversation on culture. So what do you mean by that? When we're like, it's a culture shift, what are you thinking about? I mean, I'm guessing that you're saying that we've become such an individualist society that we don't even really think about collaboration and working with others the way we should because we've all done it by ourselves, pull up our bootstraps. In healthcare, that does not work. And so I think it's a culture change. Is that kind of where you're going?
It is, and it's also breaking the culture of fear, right? Like, why don't we want to communicate with someone else? Because then we're saying that we can't do something.
Oh,
And
oh
so
yeah.
we're very irrational sometimes. And so we talk to leaders and CEOs all the time, and they're like, they're gonna take our patients. And I don't know when it got to be this whole it's our patients, so we're not gonna share them. Well, I don't think you have the capacity to x-ray and fix someone's broken arm. So I think you're going to need to figure out a way to collaborate on care for things that are outside the scope of your practice. But there is this mindset that we just do our thing and we're going to do it quietly and silently and not talk to anyone about it. And that's the culture we have to get away from because I think that's a legacy mindset. And more as I travel around and we talk to folks, those folks just need to go away because that doesn't work moving forward and where we need this system to go.
Yep. And so it is really a shift. And so it's a hard shift, but I don't get it. Maybe I'm a little bit younger and don't get it, but being trying to be the smartest person in the room that part drives me crazy because
Mhm.
I'm in the wrong room if I'm the smartest person because I'm always wanting to learn. And
Yeah.
so collaboration to me and what that gentleman was saying with his headset was that you could have the most brilliant people there to
Yeah.
make you do a better job and make better choices and make better decisions because you're having those voices say, hey, this is what I would look
Mhm.
at. This is what you should touch. This is where he was even as breaking it down like a lot of people do listen to their heart, but they don't put
Yeah.
it in the right, literally the wrong spot. And
Yeah.
depending what you're doing, and he's like, it could be as simple as, hey, move it to the right 2 inches, and you'll
Yeah.
be able to, hear it better. And he says, so it's as simple as, hey, make sure that you're listening to this in the right space because we're listening for that. As detailed as that, too. Hey, we should really get this person in because that could be a bigger problem, and they need this kind of test, that kind of test. And for you to be so arrogant to be like I know it all and I don't need this kind
Yeah.
of information is mind-boggling to me, but and we get it a lot. To your point, it's just like it's my kingdom, it's my fiefdom, I know it all, and my patients. And
Yeah.
wow, that's a bad look. I got stuck in a health situation once with a doc who by seniority in that particular hospital took over my case, who knew nothing about my case and made my life very difficult for a very long time until my real doctor got back from vacation, who saved my butt because we were going down totally wrong paths because this guy was the expert and he was the seniority. So he got to take point and he was clueless. And so when my real doctor got back and said, hey, you should check this and not all those hundred and things you've already tried, it was the right thing and it could get me help. But
I,
you get
I mean,
stuck in that hierarchy
yeah. I
of
mean, and this
ego.
may be controversial, but if all of our medical records are in one place,
Yeah.
the AI can tell us things that people can't in going through thousands of pages of records and
Right.
historical testing that there can be dots connected that no one ever thought about. And so
Yep.
we have to figure out how to use the positive in AI to be able to do things that we haven't been able to do before far faster and far more efficiently because then the doctors have something to interpret from. And we've seen examples where putting an entire medical record together can unlock some like aha moments of we missed something really huge that has altered someone's personality and we've been treating them wrong with the wrong medications for decades.
Yeah.
And we've only made their situation worse because we didn't put all the puzzle pieces together in the way that makes sense.
I've seen the science now where they can look at images and AI can almost predict where a
Yes.
cancer is going to
Yes.
form that you can't see with your eye
Yes.
today. And they're right. And
Yes.
so that is wild to me that AI can be like, hey, this is where it's going to be. And they can predict that because it's
Absolutely.
predictable, because it's been that way for
Absolutely.
so long. And so, but you're looking at the individual screen going, I don't see it, so I'm not going to treat it. And so AI, it's been over and over, and we're in the baby stages of
Yeah.
AI. So think of where we could go with this. So the positives on collaboration, really the virtual reality conversation, it was a weird one, but he's on the cutting edge of what's
Yeah.
going to come. And using AI to make more sense makes a lot of
Yeah.
difference. But on the ground, Jason, one project I just want you to touch on based on that you really did was multi-party releases of information. And that seems like
Yeah.
such a basic, boring, transformational thing, but
It
it was
is
really
boring.
useful. Well,
It
it
is
seems it.
boring.
It's a
But the most
form that you had to go through legal for, but it can be game changer for people. So
Sign
talk
one
about that a little bit,
release,
what you guys did.
sign one release of information, and then all these organizations connected to you can communicate, right? It takes away the
Fascinating.
excuse of HIPAA. Like everyone says, HIPAA, we can't talk to each other. 42 CF, we can't talk to each other. No, you can coordinate care that's in the patient's best interest always, all of the time. And that stop using this as a barrier, but as a way, because we should be coordinating care to set the patient up for success, to help them on their recovery journey. And I just lose it every time people say, well, we don't have a release. We can't talk to them. Well, no, you're obligated to talk to them. That's part of your medical oath, to do what's in the patient's best interest. And so, although it may be boring, some of those small incremental changes of just getting people together to be able to say, we're going to share one release of information and we're going to be able to coordinate someone's care can make the biggest difference, right? We know getting people closer to IT integration is going to be huge too, very costly, right? But these are all incremental steps to getting people to communicate more seamlessly. And we shouldn't be stopping those types of innovations. We should be embracing them and pushing them to the next level.
Yeah. And it just crazy to me that you could do those things. And that's when you talk about your transformation triangle that I always swear is upside down, right? You want to be transformational. That makes a real difference in people's lives. But if you looked at it on the triangle, it's on the bottom level, that top
Yep.
level of not very exciting, not very interesting, policy driven thing. But one piece of paper can change people's lives. And from a person that may be a victim or a client that have been injured, not having to say the same thing 100 times to different
Yep.
people is a game changer. And so those are some of the things that we think sometimes, well, we need transformation. No, actually, you really need one good idea that gets people brought into the same room for collaboration, and we can make
Our
a big headway.
our best work is so boring, Renee.
Isn't it? Isn't it?
Our best work is the most boring, common sense solutions
Yeah.
of just helping someone understand this is why you do it.
Yeah.
Um,
And it's funny because it's the same set of things we see pretty regularly. Once you
right.
get in the space,
Like,
you're just like,
you know how often we have to write these huge RFPs of these huge things that we're going to come in and help people do? And what is it we actually do? The most boring thing. And that creates the biggest impact.
it does. And I think it's fun too because now my brain almost has a schematic in it that it's like when you another phone call comes from another place we've never talked to about a thing. I'm like, I'm pretty sure we could do blank and it would be this. And this is how you and you kind of have it before you get there. You're like, this is pretty much the
It's
report we're gonna write. we
like,
we
I
know
mean,
where we're going.
I'm not embellishing. We have people from centers of transformations calling us, asking them, asking for our help to do things. And
Yeah.
you would think at some high, lofty educational
Yeah.
institution's center for transformation and excellence of blah, 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 because it has to be a big name with so it's a huge acronym,
Acronym. Yeah.
16 letters long.
Yes.
Um, and we're like, well, have you thought of this? And they're like, that's amazing. We're like, well,
It's amazing. And we're like, is it really amazing? Not really
no,
amazing.
but we'll
But
help
it's
you.
it's
We'll help
really
you get
fun.
there. But
I know,
yeah,
but sometimes the most obvious is not obvious, as we've learned.
no,
Just like common sense is not common. So sometimes we
yeah.
have to just circle back and be like, hey, let's talk about this. Really funny. Before we go today, everybody, I want to talk about the recovering politician self-care policy of the week. I'm trying new things in exercise. I got bored. I can swim the same number of laps. I can know how far I can go on a bike. But you know what I don't know? I do not know how heavy I can lift stuff. I've never tried. I've never thought like how big of a deadlift can I do? I don't know. Back squat, I don't know. I'm going to find out this year because you know what? I decided I'm old enough now that I want to do however much I can. So I've just decided I don't know what that number is, but I'm excited to go find out. So it's kind of interesting. It's given me something to think about, to be excited about, to build motivation. And I've absolutely never tried this before. I actually wasn't in the best shape with my joints and stuff in the past to be able to. So I've done a lot of rehab and a lot of work to get here. So now I'm just going to lift really heavy so I can beat people up. And my husband's like, why do you need to beat people up? And I'm like, you never know. So I'm just going to be prepared in case something happens. Then I can just protect myself and my friends. So, Jason, do you have any weird exercise goals for the year? I know you were talking about how cold it's been and how you haven't been able to run and stuff, and you had your bike up
I,
and you tried to kill yourself on some hills. So now what are you thinking?
I
But
did.
the
So
bike's new for you.
I've lowered my expectations and just do like 30-minute boosts on the trainer, on the bike trainer. And so if it's warmer out, I run, and then the next day I bike, and the next day I run. So I've actually been doing more the last month and a half than I did toward the end of the. I mean, because I've been home more, so that's helped a
Yeah,
lot.
that's good.
But you know what? I'm back on riding on the trainer, and so I love biking. I'm getting better at getting on the biking. So you know,
Good.
we'll see. I
Well,
need
you
to
have
get
to
out.
freshen it up. I mean, you can't just run the whole time. After a while, you're like, as you we get a little older, we're like, well, we can't run like we used to or do the things we used to
No,
do as far as we used to. So then it's like, well, this is just depressing.
but
So,
I've biked a couple hundred miles on the trainer, so I haven't
ooh,
been on a real bike in years. Like it's my road
right? I
bike in
know this
here
is
on the
new.
trainer with the screens. Like I'm used to riding through the volcano, in Zwift,
Of course.
and
Who
so like
wouldn't?
I don't know what it's gonna be like because when I go out and really bike again, I'm worried because I'll have to steer. Like I'm used to just
Oh,
looking around,
you're
pushing
just
the
supposed to look at
control
volcanoes.
buttons, doing all the things. I'm like, oh, this is gonna be different. So I'm gonna
That's
have to
okay.
figure
Well, I
out
know a
some.
guy who you can bike with, and you
I
guys
know I'm
can
gonna
figure
have
it
to.
out. I can hear it now. I know you're starting to go into your travels elsewhere and flying and whatever, but eventually you'll be like, we need to drive so we could take our bikes so that we could. It's
Yeah,
coming.
there's an
Just be
issue with
prepared.
elevation though. Some of this work we're doing in Colorado, we're up in the mountains, and so
Which
I'm
is why I know it's coming for you. So either you're going to learn a place to rent them from, or
oh
you
well.
will be figuring out a way to get them back. And I know it's coming.
We
I
have our
just
first exploratory trip where we have a lot of things we have to find to prepare for the next year of traveling.
Yes,
So
I have no doubt, but I'm just
yeah,
gonna crack up when it'll be like, we could, it's not that far to drive because we could just take our bikes.
it
I
is
have
far to
driven,
drive. No,
it
it
is a
is
far
far to
drive,
drive.
and
There's
I've done it with those bikes. And so just be prepared. It's happened before. I could see it again. Well,
yeah.
today, everybody, we talked about care collaboration. It's such a key component of good health for everyone and all types of healthcare. But in behavioral health, we really struggle and we still stay in silos and we don't collaborate the way we should. But we talked about why it's a really good thing and some of the great stuff coming up with AI and with, new ideas and how to be collaborative, and then some of the challenges that we face. And so we're going to continue on our on the ground series next time. Before we go, don't forget to follow us on LinkedIn or Facebook or YouTube. Leave us a positive review and we send you a prize. Thanks, everybody. See you next time.